Hi, friends, and welcome to Trillium Health's program Unfinished Business. I'm Mrs. Kasha Davis, your host this evening. We have an exciting show to share with you, so get comfy and settle in. First things first, let me tell you a little bit about who Trillium Health is. You'll quickly find that they are so much more than a clinic. At its core, Trillium is a compassionate team of medical and social service pros. They always meet their patients and clients in a restorative and affirming environment where they feel supported, cared for, and cared about. As a federally qualified health center lookalike, Trillium Health cares for everyone in our community. They pride themselves on their legacy, which we will touch on tonight, and their commitment to equality and equity as an LGBTQ affirming health center. So tonight, we will share with you the remarkable history of Trillium Health. You'll be hearing from their president and CEO, Andrea DeMeo, their staff physician and co-founder, Dr. Bill Valenti, along with other surprises. And finally, the crown jewel of the night, we will take a look back on Dr. Valenti's experiences through his new play, Unfinished Business, directed by David Henderson. We're thrilled to show the program in its entirety for the first time. Now, throughout the event, please consider making a gift to Trillium Health in support of their work to provide extraordinary care for all. Just send a text to the number at the bottom of the screen and get started. All funds that are raised are incredibly significant to us and helps us continue our important work. Next, you will be hearing from the man himself, Dr. Bill Valenti. As a co-founder of Community Health Network, Dr. Valenti has been an integral part in turning Trillium Health into how it stands today.
Thank you, Mrs. Kasha Davis, for being here with us tonight. We are so grateful to have you on the show with us. Good evening, all. Dr. Bill Valenti here, co-founder and staff physician at Trillium Health.
And I'm Andrea DeMeo, President and CEO of Trillium Health. Thank you so very much for tuning in with us tonight for a special evening of remembrance and celebration towards achieving a world without AIDS. Our deepest appreciation goes out to each and every one of you who has joined us this evening and all those who have given their support. The program is particularly timely this year as we commemorate the 40th year of the first diagnosed case of AIDS.
Right, that was 1981. New disease appeared and caught all of us by surprise. Not only was it new, but it was explosive, it was fatal. And there were no treatments until 1987. And a lot of sick people, and a lot of people died. You know, the intensity of the experience kind of blurred all of my boundaries. And I learned something from each one of my patients. I can still see their faces, and I remember their names.
There's no doubt that your courage and the hope that you instilled in others is woven into the fabric, Bill, of who we are today.
Thank you. And now, I have the privilege of introducing Unfinished Business, a new play based on my book, written by David Henderson. My thanks go out to everyone watching, and we hope you enjoy the show.
Well, I've been coming to this party for a few years now, since like 2028. I love it.
Yeah? I've never been. A friend had an extra ticket, so why not?
The best food. Like every year. Last year, 2030, they gave us to-go bags with grilled cheese and hamburgers. I downed it as soon as I got home.
Do they ever do a different color?
It's a white party. I mean, that's what it's called, but you can wear whatever color you want.
Let's dance our asses off like it's 2030.
Welcome to Trillium White Party. I'm your host, Steve Scheibel, a doctor in my former life, a spirit in my current one. Upstairs tried to call me an angel, but I told them I prefer spirit. and angel wasn't really accurate. Spirits led me while I was alive, and now I get to be the spirit. Tonight, we are all spirits. The world of the living and the dead, no boundaries. A zone where twilight blurs into the sunrise, where the past informs the future, where the past is the present, and the present is the future, and the future feels like the past. When time can't stand still because there's too much work to do. I mean, you remember White Party 2020, right? How could you? We didn't have one. A year that will not be forgotten no matter how much we want to forget it. There was a pandemic, there was an election, so much going on, and yet there was hope for a future in all of the chaos. You may not have thought it possible, however, it is. Bill and I believed that way back then, and we still believe it now, that all things are possible. In 1989, Bill Valenti and I started a community health network on South Ave. We wanted to offer something different, someplace AIDS patients were treated with more dignity, something personal that we couldn't offer at a hospital. More than just clinical services, but also preventative programs, psych, pharmacy, and social services. And like water streaming down a waterfall that is now Trillium Health. Tonight is the night that we celebrate that waterfall. We will dance, we will sing, and we will celebrate. But before we do that, we have some unfinished business.
June 5th, 1981. I remember it very well.
This is Dr. William Valenti, Bill, co-founder of our little clinic. I think you all might know him. When we met in the 80s at Strong Hospital, we had no idea that we would stay friends for 40 years, let alone open a clinic together. But it all started before we even met.
It was the day the CDC published its first report of 5 cases of pneumocystis pneumonia in gay men in New York and LA. The cases were reported by Dr. Mike Gottlieb at UCLA. He was a resident at Strong several years before. I called him to see what was up. He said he thought it was a virus that destroys the immune system. At the end of our call, he said, I'm not sure what's going on, but if I were you, I'd get ready. I made a new file and labeled the manila folder Infectious Diseases Other and put it in the file cabinet behind my desk. 6 months later, we had our first case. It was presented at the weekly meeting discussing cases. A resident presented a case of a local man originally from a Caribbean island, now in the hospital. He had a bizarre collection of infections, including herpes simplex of the esophagus and pneumocystis pneumonia. We had never seen them all in the same patient. At the time, I was the epidemiologist at Strong Hospital, the disease detective. And this first case was big, huge. We had no idea that this one case would turn into so many. And the questions were coming fast. How do we treat it? How do you get it? We had no time to waste. It was taking the time to ask the questions that was killing people.
In 1982, I was interviewing at Strong for my postdoc fellowship in infectious diseases when I met Bill. It was a cold, rainy Rochester day. Our interview conversation was typical. Our topics were typical, infectious diseases, research topics, and the like. But not typical was the easy rapport, the curious nature, the quick intellect, and Bill's quirky sense of humor. I knew I wanted to work with him, however, I had no idea what lay ahead of us.
I started out as Steve's mentor at the hospital, but he quickly became mine. The man was a genius. Steve was always thinking outside the box. He was the lab jockey, always on his feet, which, by the way, were always in combat boots. He was on the front lines, he used to say. Steve had a patient that couldn't swallow his pills, so he baked them into, well, communion wafers that dissolved on his tongue. They worked marvelously. Randy was sick but had to go back to New York for work. But when he got to the airport, he realized he left his communion wafers at home. Randy was sitting in his seat when the pilot called out his name, followed by, "We have your drugs." Randy's father had rushed to the airport and handed them off to the pilot. Randy recovered that time, thanks to the wafers. Where did you get those wafers?
Our friend, Dr. Voisin, you know him. There was this priest who owed him a roll in the hay.
And Rodney called in the favor?
We needed those wafers, Bill. We needed all the help we could get, and we took all the help we could get. We knew this was not going to be a single-sided approach. The fight against this disease had to come from all fronts, and it was hard on everybody. Nobody escaped death, even if you didn't die.
I used to play in the basketball tournaments during the summer. I would always buy me a new pair of sneakers at the beginning of the season.
Julian Brown, team leader of Healthy Homes Initiative.
I think it was like the second or third year of my diagnosis. I didn't know what made me even think of it. But as my friends started to pass, I would write their initials on my sneakers. So I started at the first tournament. I think it was in the early May or April. But then that last tournament I played was Labor Day weekend. And this little kid walks up to me and says, "Wow, where'd you get those cool black Air Jordans?" And I looked down. And they actually looked like I was wearing black sneakers. And I didn't realize that's how many people that had passed that summer. Ever since then, I don't wear black sneakers. I don't wear white sneakers. Not anymore.
In 1985, there were already 100 people diagnosed in Rochester.
Evelyn Bailey, retired teacher and queer archivist.
And stigma, we became a isolated community. People saw us as a source of this disease, and we became ostracized. But the drag queens rose to the occasion and raised a lot of money. Wayne Esposito, you know Wayne, Jimmy Catalano. Oh, it was important for them to be involved. Who led the Pride Parade? The drag queens in all their crazy attire. The women, the lesbians. We took care of the gay men who were sick. We brought them their food, and we cooked, and we took them to their appointments, and we cleaned their apartments. We did whatever we had to do to help.
Like I said, we needed all the help we could get. This disease was attacking us from all sides. Our friends were dying, and our patients were surprising us at every turn with their illnesses. Anne Zettelmeyer-Griep, doctor of psychiatry, we worked with Anne at the hospital, and she pitched in when we opened.
The first time I met Bill, oh, that is a story. I was a resident in psychiatry in the university, and he was a fellowship. It was 1986. I ended up doing another neuroscience fellowship, and the chair of my department, Dr. Kane, said, they have this real need at the HIV clinic. And there's this guy, Bill Valenti, and he said, "You want to meet him?" And I said, "Okay." So I got down there, and we met, and we talked for about, what they may need to know, what patient care, and how to do that, etc. And then, what we laugh at is I love how Bill always tells me his version of the story, which is, he thought, they sent me this kid, you know, and what do I need a psychiatrist for? I need more help. And then, like 3 days later or something, there was this guy that was handing out Bill's card out at the Changing Scenes. You know, that revolving restaurant in the First Federal Building. And he was using that to try to pay his $200 tab. Luckily, he had one of Bill's cards in his pocket. It was our first case of AIDS dementia. And it was like, oh, I guess we do need psychiatry. And then Bill and I were friends from then on, really. Not too long after that, I remember Bill and I carved out a pumpkin at my house. There was like a real connection. You know, he's my son's godfather. I even got married at his house.
The first few years of this new and devastating disease was hard for everyone. Not just the patients, but the doctors and the nurses, too. A nurse getting stuck with a used needle in the 1980s was akin to a horror story, but we tried to minimize feelings of terror and stigma.
It was so crowded in there. I tripped.
It's not your fault.
I tripped on a strap from the ambulance stretcher.
It was an accident. It could have happened to
Yeah,
anyone.
but it frickin' happened to me. Damn it. You're positive, too. Is it bad? I can't see it. I can feel it, but...
What size was the needle?
It was big. If it wasn't bad, you would have just said so.
It's not great. We just don't know how bad it is yet.
I followed all of the protocols. It was like Looney Tunes in there.
Well, it's not in here. No Looney Tunes in here. I'm Bill. I work with the Infectious Disease Clinic on treatment and prevention. I was standing at the phone when the head nurse called.
Right. She said she called the AIDS doctor. I'm sorry.
I'm fine.
My fiance is on his way. I have to tell him.
When are you getting married?
A month. Now, maybe never. I can't believe this. Sorry, I'm
not taking it personally. It's okay.
I just can't believe this. What's gonna happen? They're never gonna let me work in ICU again. Oh, this is the worst. They won't let me back in here, will they? I'm not gonna die, right? Please tell me I'm not gonna die.
We don't even know if there was transmission. And not everyone dies.
I don't wanna die. I want a baby. I wanted a baby. Listen to me. I'm talking like we tell the patients not to.
Right.
What is wrong with me? Take a deep breath.
No one said you can't have a child.
What are you, the welcoming committee? Oh, I'm gonna get AIDS, and my baby's gonna get AIDS, and
That's not true. That's not true. There have been a few cases where negative babies have been born to positive mothers.
Not with my luck.
Here, I have pills for you.
Is that AZT?
Well, we think that that's...
How do you just have those in your pocket? Those are impossible to get.
We keep a stash. Families give us what they have left over, or we ask if we can have them for moments like this, or when someone can't afford the medicine.
You mean when they die? When people die, you just ask for their medication?
Exactly. So we can give it to people like you.
Okay. I mean, I've seen what this stuff does to people.
It's not perfect, far from it. But if you start right now, there's a chance you might be able to get a negative test and stop taking
Wait,
the
you
medicine.
want me to take medication for something you don't even know I have?
Yes, we call it early intervention. The sooner you start treatment, the better chance you have. It works. Fellow doctor approved, I swear. Now take those now and just start it. I'll get you some anti-nausea and anti-diarrhea scripts, aspirin for any pain, and if you need something stronger, just simply ask.
the nurse becomes the patient.
You're not the first. And unfortunately, you won't be the last. I have friends who are patients. Patients that are friends. I chose this, Jesus, to help people with HIV/AIDS. We think this medication can keep you from getting HIV.
How?
Some doctors swear that early intervention can prevent the development of HIV.
That's not FDA language.
I never said it was.
Nobody has to die on purpose, right?
Not long after that incident, the hospital had a big meeting about it. The nurse was able to go back to work. However, many felt that she should not return to the ICU.
It made no scientific sense to me. I held my ground at that meeting, beating the drum that there was no risk of HIV transmission to patients. It would not be necessary to restrict her patient contact in any way. I refer to the reports from Europe where there had been no transmission by an HIV-positive surgeon to patients during surgical procedures. They wanted to reassign her to the outpatient clinic. The administration claimed no one doubted the science. The decision to restrict the nurse's activities were administrative and took into account the hysteria of the era. At least there was never any discussion of terminating the nurse. Steve and I had talked about our own ideas of HIV care since the day we met, and it didn't always gel with our bosses at Strong, to put it professionally. We both realized that if we wanted to go and give HIV care our way, it would need to be done outside of Strong and in the community. My last day at Strong was December 21st, 1988, and Steve finished his fellowship in June of '89.
By the time we opened the Community Health Network in 1989, almost 25,000 people in the U.S. had died of AIDS. I had spent the last year working out of my house, going on the speaking circuit to make money. CHN was poised to be the forefront of the AIDS effort. We had a mission to provide one-stop shopping, medical care, pharmacy, mental health, food pantry, emergency funds. It was a team effort. Carol Williams, Ann Zettelmeyer-Greep, Tony Obermeyer, and the volunteers.
So many volunteers, so many patients. Patients who became friends, and friends who became patients. Like that famous book, it was the best of times, it was the worst of times. We made it work, and we had to. Our lives depended on it. Our friends' lives depended on it.
Am I late to the party?
The party didn't start until you got here.
Word. How come no one's dancing?
We've been busy.
Is he taking everyone down memory lane?
This is Tony Obermeyer. Like me, she is from the land of the dead.
I got this. Hey, y'all. I am Tony. You can call me Tone, the Tone, Tonio, or Tonorama. I got caught up with these suits because Bill lost his wallet and my son found it and returned it to him. The instant we met, I was never the same again. I totally think that we were destined to meet and that we were totally supposed to be doing good work together. How did I do?
I couldn't have said it better myself, Tone. Let me introduce you to another important fighter for the cause, a perfect example of...
Did someone say perfect?
That was me, John.
Steve, it's been like seconds. Tony, my love.
Like I said, time is different up there. Before he died, John Washburn was what you would call an AIDS rock star in Rochester, a high-profile community member who used his influence to educate others. He was the superintendent for Brighton schools.
I was a school administrator who also had AIDS. Top of my field when I was diagnosed. This guy here, Dr. Hot Pants, he's the one who helped me die gracefully. But I wasn't the kind of person to sit back and watch life go by. So while I was waiting, I started to go on speaking tours, talking to other educators and administrators about AIDS, to take away the fear and the stigma that was so pervasive. I had a microphone, and I used it. Wasn't easy. I speak out because my higher calling has always been to teach. My aspiration has always been to be a good teacher. This disease is a reality of your time. We can learn a lot if we confront the reality boldly, with integrity. Many people, instead of looking at the lessons AIDS can teach us, are unable to get beyond the issue of drug abuse and homosexuality. We desperately need to get beyond such narrowness. Those of us who are parents, educators, and community leaders cannot disregard the responsibility to educate our young. The need is critical, and the price is high. Sure, death is a high price indeed for ignorance. Any solution to the AIDS problem will demand specific know-how. Thank heaven for progress here. Stark realism and compassionate judgment. It wasn't easy, any of it. There was a lot of pushback, but I had the microphone. My voice was louder. Speaking of pushback, will you dance with me later, Steve-O? Later, Tone.
I have a surprise for you.
For me, you rock. It's Felice, my daughter.
Tone, she wasn't scared. She was fearless. She went into the street, got the people. She would walk up and down Clinton Avenue, Joseph Avenue, Jefferson Avenue. This white woman, yeah, you would never think of talking to, go up into the shooting galleries for heroin and everything and pull the people out. And she just knew how to. She had the cause. She lived that life. I have it where she wrote a list of definitions, and she typed it up. Yeah, because she was bringing the people on the street to the clinic, and the staff didn't know what the hell the people were talking about. And so she was like, really? I'll never forget. I remember the conversation. She called him and told them they had to learn the lingo. Uncle Bill, she said to me, he's so damn cookie cutter. So she made the list of things, the definitions for them of the street lingo. I got it. It's in a box. I got a lot of original. I have one original clipping from the newspaper. My mom's at the bottom of the staircase looking up, about to go into a shooting gallery, and they took her picture. And those are from the actual newspaper, they look like. They all worked really hard to get that place up, the CHN. It was passion. It was love. They wanted to save people. They really did.
My beautiful baby. I come down here and sit with her all the time, and I whisper into her ear, and her brother, and Bill, mostly when he needs a quick kick in the ass, but sometimes just to hold his hand when he doesn't even know that he needs it.
You've been at this a lot longer than I have.
I can't even tell time because until I come down here and I see her get older. If we're not going to dance yet, let's take a little trip.
Oh, look. It's the first office. This has got to be when we opened.
Rad. That calendar over there says 1989, July.
Place needs a bit of work. I remember it just like this.
All this cloak and dagger.
Ma, I told you, it's a backdoor thing.
Looks good in here.
What? Are you supposed to use a special knock or something?
No, I don't think so. I don't remember.
Welcome, welcome. I am Steve. Pardon our dust, we're still...
That's okay, it's fine. She's more nervous than I am.
Hi. My name is Dr. Scheibel. Steve. You can call me Steve.
And you call this a doctor's office?
Ma,
I promise, if it wasn't safe, we wouldn't be doing it.
you didn't have to come.
Oh, I had to. I wanted to make sure you'd go through with it.
We are here to help. What can I do?
Where's Dr. Bill?
He's caught up at the hospital. He should be here shortly. I'm Steve Scheibel, Bill's partner here.
His partner?
His business partner, Ma. Can we wait for Dr. Bill?
Not a problem at all. This really is our first night, so no magazines or anything, or water fountain. I think I have an extra Coke around here somewhere. Oh, I hope this isn't Carol. Hello?
Are you sure this is a doctor's office? That man is wearing combat boots. They can't be very clean.
They're not going to let me back in here if you don't stop.
What? Can't a mother express a little concern for the handsome young doctor dressed like a biker who's going to care for her son?
Dr. Bill is not so butch. Really cute. I mean, this one's not my type.
You listen to yourself.
You started it. You said he was handsome, not me.
Enough already. Didn't start anything. This is your mother that you're talking to here.
I'm not a monk, Ma.
Well, spare me the details.
Steve, it's Carol. What are you doing there so late? I'm looking for Bill.
Bill's not here, but I will tell him you called. I'm here just giving the place a little TLC.
That place needs it. I mean, it's coming along, but the contractor is
This
dragging...
place is looking great. What are you talking about? You make a great construction project manager and head nurse. You're a major domo, our chief steward.
As long as we're saving lives, whatever it takes. You know, I've been working on these NYC clinic state licenses. Everything has to have a policy and a procedure. I've written one for everything we do except go to the bathroom. And they might even ask for a policy for that. Every time I submit the application with all the policies and procedures, the health department requests another. Can you tell me more details so I can locate that information? We don't have any specifics, but we need a policy on such and such. Just a minute, I say. Ran to my office and whipped up a policy on such and such. This has happened a few times now. They want our ducks in a row, and we can't mess anything up because we are under the microscope.
Oh, yeah? Well, no funny stuff here. Everything is on the up and up here. We're great here.
Stop sniffing the paint. See you in the morning.
That was the hospital. Said Bill left a few minutes ago. Should be any minute.
Not even in the building? In a neighborhood like this one?
It's great. I love it around here.
You fit right in.
He's real talented, you know. Bill, not just in the medical arts. He's been in the Nutcracker, too. A fundraiser for this place. Bill was Mother Ginger and wore a gigantic hoop skirt. Ugly get-up. Big enough to fit all the little children who were going to be popping out from underneath. Fully dressed on stilts, no less. Mother Ginger was almost 10 feet tall. When it was his scene, he shuffled onto the stage sideways, trying not to step on the dozen 5-year-old ginger babies underneath. One false move, and the children would be crushed, and the show would be over. When he reached the center of the stage, the kids popped out from under the skirt and did their little dance, and he just stood there, frozen and fearful that he would tip over. Their dance finished, and the kids scurried back underneath Mother's skirt and for the exit. We do anything for this place, and the people will come here. Leather daddies, transsexuals, bisexuals, heterosexuals, you name it.
I see. And you? Do you have any jobs on the side?
Cool. Did you say you have a Coke?
Don't give him a Coke. It's too late for all that sugar and caffeine.
I want the Coke.
Yeah, it's around here somewhere.
This is not a doctor's office.
Oh, well, we're not just a doctor's office.
I knew it.
We're a doctor's office, but also a social work office, a lab, home care, a food pantry, a social club, one-stop shopping. That's what Bill calls it. It was his idea. Got the rest of us on board. Our patients, well, they have a hard time running all over town to get their stuff done, so we put under one roof.
All that in here, in this small place?
Like I said, it's our first night. It's a work in progress.
You want to take me somewhere else?
That's not what this is about. I don't care about the AIDS. I just want to make sure that...
We're good people, and we're going to take good care of your son. It may not look like it, spackle and all, but we have been at this since the beginning, and we want to do more. This is just the start of it, and we're not going to fail your son or anyone who comes to us.
Who's Carol?
I'm sorry?
When the phone rang, you said, I hope it isn't Carol.
Oh, Carol is our head nurse administrator, that's all. And she doesn't know we have a night clinic, so we don't tell her. But we have our regular clinic license, and I am a licensed doctor, and your son needs treatment and care that we can give him.
This is all just a little bit too...
You couldn't bring me any other time. So this is the time I had to set up with Dr. V. We couldn't go back to the hospital. It was too expensive.
So this is all we have.
We've got it all, right here. No one else has tried it yet. However, we think it is going to be amazing for our patients. Bill should be here any minute. I'll be right back.
I am dying, and these people are putting their life on the line to take care of me. I just want someone to take care of me.
You are not dying. And me, I can take care of you.
You can't do it all. Ma, let them help with everything, with visits and all the crap at the end.
It's not going to happen.
It's going to.
I'm so sorry I'm late. I got held up at the hospital.
It's okay, Dr. V. Mom, this is Dr. V. Dr. Valenti, this is my mom.
Wonderful to meet you. Thank you for coming, and pardon all the dust.
Oh, I've heard all about the dust. Just take good care of my son.
You have my word. You met my partner, Steve. Business partner.
Yeah, he let us in.
He's very...
Oh, don't let him fool you. In those combat boots and behind that gruff is a lab geek. Now, one of these rooms will be my lab. Me, I'm the heavy around here. Lots of patients, meetings, and paperwork. Oh, and I make a mean pasta salad. Everyone loves my pasta salad.
He said you also made a very tall ginger lady in the Nutcracker Ballet.
He did he? I've asked him to stop scaring people off with that story. We'll never have any patients.
I imagine you have to find ways to have fun. I can't imagine this as much fun.
We have our fun. You know, we had a dance party here last night. We had spent the whole day working on the place, and someone brought in a boom box and one of those, disco tapes, and we danced for a good 15 minutes. The why, the hustle, and then we kept on working until we're late. We just had our best fundraiser this weekend. It was a dinner thing with a big party afterwards. Did you go?
No. I had a ticket to the dinner thing, but I was too sick that night.
Now, that was one hell of a party. We raised
And you can dance, any dance you'd like to, as long as you...
Maybe we should get started.
Follow me into exam room 1.
I'll be in the waiting room.
You want to come in? You don't have to sit there all by yourself.
Oh, maybe I'll just do a little cleaning while I'm waiting.
I was a social worker at Strong, and in 1982, a young man with AIDS was admitted to the OBGYN floor.
This is Sid Metzger, CHN's first social worker.
The hospital was short of beds. The staff didn't know what to do. It was all so new. I went to the directory and I found Bill and asked him to come to the floor and meet with the staff. A year later, Carol Williams, the CHN nurse, called and said they needed a social worker. I started 2 weeks later, thinking that, well, maybe I'd stay about a year or so. I retired after 12 years.
Sid ran a support group for mothers who were caring for their sons.
Their sons were bachelors, and so many of them had moved to bigger cities, got sick, and moved back to Rochester so their moms could take care of them. And every Thursday morning, if they weren't at an appointment, the moms would meet for coffee.
You don't have to talk like I'm not in the room.
Blurred lines, all night long.
That group of ladies saved my life. I didn't laugh a lot back then, but when we got together for coffee, we laughed. We laughed a lot. Sometimes we cried, but mostly we laughed.
It was all new territory for us. There wasn't a manual. There wasn't, well, we just did what needed to be done. And the caretakers needed to be taken care of too.
You held our hands.
Time for coffee. The others are waiting.
So many people suffered. Sometimes the hospital just made things worse. Staff that didn't know how to take care of people with AIDS. Dinner trays were left in the hall because the food service workers were afraid that they'd get it. Sometimes they didn't even get a room, just a chair in the hallway.
Hi everyone, it's Mrs. Kasha Davis again. Thank you for tuning in with us tonight. We hope you've enjoyed the program so far. Woo! Now, sharing the history of how Trillium Health got to where they are today reflects the evolution of HIV treatment and how services expanded as the need increased. The response from the community was tremendous in the early days and continues into today. If you'd like to be a part of Trillium's community support, we encourage you to make a gift by texting the number at the bottom of your screen. Every dollar helps us provide equitable and extraordinary care for all. Now, don't go anywhere. We'll be right back. Up next, the second act of Unfinished Business will show the present state of the HIV/AIDS journey. So sit back, relax, and enjoy a message or two from our sponsors.
Looking for a doctor? Trillium Health has primary care at Monroe Square. Our convenient location in downtown Rochester is along a bus line and has plenty of free parking. We're accepting new patients. Call us today. Pathway Pediatrics, a division of Trillium Health, offers positive, affirming health care for LGBTQ+ children, teens, and young adults, welcoming all gender expressions and sexual orientations. Pathway Pediatrics is accepting new patients.
Welcome back, everyone, and thank you for joining us for Trillium Health's special Unfinished Business fundraiser. I am your MC for the evening, Mrs. Kasha Davis. I'm a married lady, that's right. And now we will be taking a look at the second act of Dr. Bill Valenti's play, based on his memoirs. As it stands today, Trillium Health focuses on caring for the whole of the patient. Even their logo, the Trillium flower, symbolizes this. The 3 petals represent their comprehensive model of care, treating the physical, emotional, and social health of their patients. Keep this in mind as we now take a look.
Hello. I'm stopping by to check on you. Took a while to find you. They keep moving you around, not sure how you ended up in a hallway. But I know you can hear me, and you can feel my touch. They say that people in a coma can hear the people around them, so I thought maybe I would come by and hold your hand. Talk to you. Maybe do a little two-step for you. No, not really, no. Jesus. You're still breathing, so that's good. You look better. Stable. You went downhill so fast. It feels like just when we're getting a little bit ahead, we get sucked in the kisser. So I'm on my rounds, had a chance to get away with the office, you know. I haven't seen you since you came in with your mother. You know, the clinic is now bona fide with carpet. It's going to be wonderful. A place for everyone and everyone in the place. You like the sound of that? I do. Oh, well, how about Carol, huh? Finally got to meet her. Carol Williams, best in the world. What did you think of her? They broke the mold with her, let me tell you. Mother, daughter, father. She could do it all. Friend, nurse, social worker, saint. You know, she's the one who kept you alive last year. Of course you know. If she hadn't had the idea to put you on steroids for the weekend, you would have died then and there. It was her idea, and she made a promise to you. If it didn't work, we would remove the breathing tubes like you wanted. But we didn't have to do that then. The steroids worked, and you got better. What would I do without all these people helping? So many people. Steve, Ann, Carol, John, Tony, all of them. I like to have good people around. You know, your mother, she's still coming. Every day. That doesn't always happen, especially at the hospital. So many families abandon their children. Oh, you know, Carol's pretty good at volleyball, too. A bunch of us play at my house on Sundays. Sometimes we even smoke a joint. But that's between you and me. And sometimes we're here instead. Not playing volleyball. Playing keep away. I just want you to win, and I want all of us to win. But that's just... Oh, shit, I hate this part. I hate it. It's just not reality. I try to stay optimistic. I try to say all the right things, but way too often, this is just powerful. It's so powerful, and sometimes I feel powerless. God, I hate this. Oh, God. The mood struck me. A little two-step. Late, but it struck. Reminds me of a drag number we did at a fundraiser. You should have seen it. Yeah, that's a tale for another time.
How is he this afternoon? I went to Mass.
You look peaceful.
How is he? How is he today? How's my baby boy?
He's resting.
He's been resting for 2 weeks. And why are we out here in the hall? It took me forever to find him.
They promised it was just until they finished shuffling people around, and that was a while ago.
My baby boy, so young. I overheard the nurses talking about you, my baby boy. They were saying how handsome you were. You know, they talk in the past that you were that hot before and that you're not hot now. You're ugly, emaciated, dying. The rest of us have to deal with it and look at it and take care of it. Is that how you see me? Or the mother to do it all and look past that? When I look at you, baby, I see the little human that I gave birth to all those years ago, with fists and gangly limbs. His arms and legs were so long. Or I see the kid who cried because he ran over a squirrel with his bicycle that was already dead. And there is the boy who asked about love and who you could love. No matter how down on his luck or out of a job, who delivered newspapers until he couldn't lift the stacks anymore. Whether I was changing soiled sheets or feeding you applesauce or letting you squeeze my hand for the pain, I see you. Who you are now or whatever here in this hospital bed. I see that reality, but I also see here all of your realities, all at once, like a giant, shining star. I wonder what he sees when he sees me. Does he hear the tone in my voice, or are the wrinkles gone? For the first time since creation, the face of the woman who is his mother? Or am I the older mother who slapped him for stealing? Or the young one who used to bathe him in the sink?
We all have our own touch. I dance, you talk.
But what? What are the answers to the question you're always asking? How? How do we stop this thing?
That is not an easy answer.
Don't try to dance your way out of this one.
Like I said before, no. We don't have an answer as to how to stop this, but we're doing everything we can think of to try. Your son is part of my family, too, and Steve's family. And we're a part of his. You're a part of our family, and we're looking and searching and looking for the right drugs, drug cocktails. Steve is even trying to develop a vaccine. Some people we can help. Either help them get better or keep them from dying. Others we can't help. But not because we haven't tried.
We've tried everything, baby. Everything. It's okay to go. It's okay. You can go.
For 20 years, the Community Health Network worked hard to help as many people with HIV and AIDS as we could. Support groups, financial aid, clinical services, and so much more. Bill and I worked hard to give the place a solid foundation. We weathered hate mail, navigated budget cuts, instituted name changes, and evolved our mission. We saw people die, but we were getting better. But I was missing something. Something that I knew that CHN couldn't give me. Lab space. I wanted to work on drug combinations and immune response. So I headed west to do what I do best. And that's where I met my husband, Chuck Marbley, Vice President of Specialty Services at Barriga Health in California. My husband and partner of 20 years.
So, I am an RN. I am an RN because of my husband. We were together for over 2 decades. And in that time period together, I met enough of his patients that said, had it not been for this man, I would be dead. Had it not been for this man thinking outside the box, I wouldn't be here. That man worked out of his house, drawing blood over the kitchen table using a minus 70-degree freezer for the samples. We called it the kitchen clinic. We kept that sub-zero freezer in the centrifuge in the bedroom, and he would sneak blood draws into, I think, a UCF or UFC or UCD, UCFD or whatever it is. The university there to get to the lab and get the work done. And that's when he showed that early intervention worked. The virtual loads were starting to depress until they were gone. He took everything he learned as a student and from his work in Rochester and brought it all together to the kitchen clinic. And I thought to myself, what am I doing at work besides just going? What am I doing? Here's Steve, saving the world, a genius. So fast forward today, I am not only an RN, but I'm the vice president of the specialty services at Barriga Health in Palm Springs. And that's a lot of Steve.
Back in New York, Bill and his team were making strides in growing the clinic in new ways.
I was with Dr. Valenti. I think this is 2016, when U equals U was announced.
Dr. Ashley Zappelli, Director of Innovation and Clinical Pharmacist at Trillium Health.
U equals U. So, undetectable viral load equals not transmittable. Uninfectable. The Department of Health had a big webinar. We all went to Monroe County Department of Health, and we sat there with just a small group of people and watched the whole thing. But for them to say that you cannot transmit HIV to your sexual partners if you're undetectable, it was like, that was huge. Also, he took a picture. He has a picture of that moment of my face. The shock, the amazement, the excitement that these big and little wins might get us somewhere, are getting us somewhere. It's not like we're not aware what a miracle cure is. We know that the chances of that are slim, but it's not like we are going to stop trying. So little wins are a big thing.
It's well, the first time that I can really remember having discussions, like my freshman year of high school in my health class, like 2000.
Danny, insurance specialist at Trillium Health.
Which I feel like is not something a lot of people can say about their health class. I just remember, I don't know, I liked my health class. I felt like it should have been every semester. It could have definitely lasted much longer because it was only one semester of my whole high school career. Yeah, but basically, we spent a lot of time talking about HIV. I wish it was longer. I remember kind of like getting into it. And so now I'm here at Trillium.
Andrea DeMeo, CEO of Trillium Health.
The future of HIV and AIDS. Bill often talks about the right ingredients for the salad. We have all the ingredients to be the world-class healthcare provider of HIV prevention and treatment. We already have linkages with premier research institutions such as the University of Rochester Medical Center and what they're doing with vaccines. We need to raise the bar for ourselves, for the greater good of the community, the state, and potentially across the nation. What we are doing is exemplary. We were recently named a Ryan White designated organization, and we had our on-site visit a month or so ago. They said organizations would give a lot to have the degree of talent and competency of our organization. We have world-class talent here. We've done a lot of work on ETE and the epidemic 2020. But let's raise the bar and share our learning and learn from others. To be the best, to be the model other organizations and communities can model after.
I just had a group on Friday.
Erica DeJesus, Prevention Specialist at Trillium Health.
For a group I'm starting for women of color. So I think for me, the importance of PrEP is that it should be available to everyone, and everyone should know about it. But I definitely see a lot of times that it's not out there, the information. Men who have sex with men, there are more of them that are on PrEP than there are women who know about PrEP, and especially more than women of color. So my focus is getting that information out there to those women and, letting them decide what is right for them. But they have to have the knowledge, whether it is PrEP or it can be STI testing or any kind of services that they need, that they have to have the information, how to get it, where to get it, why it is beneficial for them.
I have a lot rattling around in my head.
Jonathan Jordan, Director of the MOCA Center.
There's a lot that goes into PrEP. I think we do same-day PrEP, so there's an immediacy to it, but I also think for a lot of people over time, there's a level of building trust with them and doing some education. I oversaw testing for, 5 years. So I've been it's where my brain is still a lot. So I think there's a lot of education that comes with having somebody be comfortable with that. Plus, we know there's a lot of, history, really bad stuff that has happened to people of color when it comes to medical procedures and when it comes to drug testing and things like that we have to overcome. A lot of people think that PrEP is not appropriate for them because of their relationship status or saying, I'm not like those people. My personal crusade lately has been getting people not to ask on Grindr, are you clean? I can't tell you how many times I get blocked because guys are like, are you clean? And I'm like, well, I haven't taken a shower today. I'm a real smart ass about it. But if you're asking me if I have HIV or if I have an STI, I'm recently tested. I don't have either of those. So next time you want to know that, then ask that question specifically. There's a level of stigma fighting that we have to do to normalize PrEP. And I think we're doing that. I think there's a lot of trust building, a lot of education. We lay the groundwork in order to get people to start PrEP and understand the importance of it. I also think that moving forward, the ease of PrEP will be a big thing. if we're able to move past a pill a day to maybe like a shot a month, a shot every 6 months, a shot a year, or an implant perhaps that will make things easier or more accepting of that. I think we also have to just change our marketing a bit too. Because I think at the beginning we marketed way too much to white men who have sex with men. And now we're trying to sort of backtrack on that. And that's really hard when you have already created like this level of, this is who it's for. Even if that wasn't the intention.
I just don't know where to start.
Chuck Marbley.
How are we dealing with it? My community, the black community. We're still figuring it out. I want to go to the barbershops and the churches. There's a doctor in California who challenged the church in his area on HIV education. Lead your flock, he said. He changed them around because he knew who was leading the church choir, who was playing the organ. He knew. Boots on the ground people. He changed them around because boots on the ground people. For our transgender population, our strategic planner is African American, Native American, and was homeless. She says she's red, white, and brown. In California, the people running our transgender department are transgender. But we need nurses, doctors, and support. Steve died in 2019. We were supposed to come to Rochester that weekend for the white party. He never forgot the work that he did. We came back as much as we could.
Steve's death, it hit me hard. The man I admired, the friend I shared my dreams with, someone I was growing old with. The country may have separated us, but we never grew apart. All of these deaths and all of these funerals, and it still gets me. You think I'd be used to these emotions and tears that come along with all of it. It gets harder when it's someone like Steve. The next year didn't get any easier. Still processing his death, the world was immobilized by another infectious disease, COVID-19. But as everyone was freaking out, it was amazing how quickly we were able to mobilize for COVID-19. So many parallels to the AIDS epidemic, from wearing the gowns and masks to recognizing early intervention. We have known for years that testing is important, contact tracing, all of it. So we were ready for COVID-19 testing and COVID prevention and taking care of patients who are really sick. Trillium was able to weather the storm and give our community shelter in all sorts of ways. It was also a big year for us financially, but not in a good way. We couldn't host the white party, our biggest time to raise money for all of this. You see, our fundraisers, they keep us afloat. It all started with Dining for Dollars, and now it's the white party. Ugh, and they're a hoot.
Hey folks, it's me, Mrs. Kasha Davis, and we hope you've been enjoying the first ever viewing of Unfinished Business, a play based on Dr. Valenti's memoirs and directed by David Henderson. Oh, I've had fun too. It was sans wiggery. The Trillium Health story is one of passion, perseverance, and innovation. Beginning as just a small HIV/AIDS clinic in the 1980s during the difficult times, they are proud of their legacy as a leading LGBTQ+ healthcare provider in Rochester. If you would like to join them in their efforts, please consider making a gift to Trillium Health today to help ensure a brighter tomorrow for those who depend on them for care. Just start by texting the number at the bottom of the screen. And now we'll be right back to continue the program. See you in a drag queen minute. Woo!
Did you know that Trillium Health offers free testing for HIV, STDs, and hepatitis C? We can mail free, confidential home testing kits to anyone living in New York State. Call 585-210-4275 or visit trilliumhealth.org/home testing. Trillium Health is a leading provider of PrEP. PrEP is a medication that can prevent HIV. It's convenient and affordable. Most people pay little to nothing for PrEP. Call 1-888-PrEP-123 or visit trilliumhealth.org/PrEP.
Good evening, friends, and welcome back to Unfinished Business, Trillium Health's virtual fundraising event. I am your host, Mrs. Kasha Davis from Fairport, New York. Next up, we have the final act of the play, reflecting the future that Dr. Bill Valenti hopes to see. And simply, the goal for the future is a world without HIV/AIDS. In the words of Dr. Steve Scheibel, the late co-founder of Community Health Network, alongside Dr. Valenti, there is one word that envisions a world without AIDS: happy. We hope to honor this memory as we look forward on Trillium Health's journey.
I've been coming to this party for a few years now, since like 2028. Oh, I love it.
Yeah? I've never been. A friend had an extra ticket, so why not?
The best food, like every year. Last year, 2030, they gave us to-go bags with grilled cheese and hamburgers. Oh, I downed it when I got home.
Do they ever do a different color?
It's a white party. That's what it's called, but you can wear whatever color you want, sis.
Brother.
Oh, I didn't mean it like...
I just don't want to be any confusion or anything.
I'm sorry, that's not how
It's okay, I'm just making sure, and I'm really nervous.
We cool?
We're cool. I saw you earlier today, too. I mean, after we communicated.
Oh, I'm on that app all the time. Not like...
Oh, yeah?
So, why did you... What made you message me?
Oh, on the app?
Yeah.
I was looking around. I started looking around again, and I don't know, you were like the only one with more than a nipple shot and a real smile.
That pic is my fave. Best lighting.
Yeah.
So you liked my smile?
Yeah, and you said you were open to...
When we were chatting?
Your profile said you were bi and into people.
Oh, yeah. Come as you are.
Okay, good. I didn't think we'd start with that, but it seemed like something important to bring
Oh,
up.
you're nervous. Your hands are shaking?
This is my first date. Yeah, not my first date, but my first date. I haven't been on a date since like the 20s.
Oh. 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 Well, then have a sip of that drink and we'll go dance that nervous energy right off.
I do like to dance.
I love dancing.
Maybe in a few minutes. What are you drinking?
Just a club soda. I'm taking a break.
Already had a few before you got here.
A long break. I haven't had a drink in years.
Long break for real.
I didn't like how it made me feel anymore. Took a couple of times, but it's been years.
I can go get something else if it
Oh,
bothers-
no, you go right ahead. It's not like when I saw your profile, well, that I wondered if you drank. You said 420 friendly, so I figured.
It seems so cheesy to put that on there, but some people get scared, so I
It
figured.
didn't scare me away. I like friendly.
Have you been on lots of dates with people like...
People like you?
Yeah.
A few. Have you been on lots of dates with people like me?
I haven't.
That's an interesting answer. What did you think when I said people like me? Oh my God. Oh, you don't have to answer that. I was just kidding.
I can't tell if you're making me more nervous or more relaxed.
Well, chocolate fixes everything. Oh, do you see that person? That was the first doctor I had at Trillium. She's Mexican, like really Mexican. She's from Mexico. My mother's Mexican and my father's black. So.
Do you go visit?
Oh, I've been back a bunch of times. I'm just so glad I have doctors here, like her. It was my first time going to the clinic. I used to hate going to the doctors. I got that from my dad. He never went. Didn't trust doctors. Said his mother and his father, once they went into the hospital, they never left. They died there. So there was no way he was going to. Oh, anyways, I pretty much had to get over it once I found out I was positive.
I saw that on your profile, too.
No shame, no blame.
I'm negative.
Yeah, well, I might as well be.
You have one of the IUDs.
Oh, yeah. This is my second one. Got my first one 11 years ago. Love it.
My doctor said I can do it when I don't want to take the pills anymore.
I would do just about anything my doctor said. From the moment I saw her, I knew it was the perfect match. Like, when I walked in that room, it was like looking in a mirror. A face that looked like mine, and this wave of relief and recognition and connection. It was like we were on the same level, understanding what was happening without saying anything. We, didn't for, I don't know. Seemed like minutes, but it was probably seconds. There was a face like mine. There was an understanding like mine. Someone who knew things I knew that other people can't understand.
I get it. I don't like... Male doctors are not my preferred gender for the provider. I just want a female, even now. I mean, I don't know what it's like to be not white, but...
You're so polite. Not my preferred gender for the provider. Well, like you said, I can't imagine to know, but I can empathize.
And it's not like they're trans themselves. Yeah, that was the weird thing. Figured I was going to have to go somewhere else, a bigger city, but they're not. They're right here. A lot of the guys I know tell horror stories, botched surgeries, PTSD. Wow, intense convo.
What else should we talk about? The weather? It's 2030. This is the important stuff, the stuff we should be talking about.
Things have changed so much, you know?
Hallelujah.
I know, I'm just a little wary still.
No sweat. Speaking of sweat.
Want to dance?
Hallelujah. Woo!
Okay, who should I make this out to? Oh, you're going to have to yell over the music. Haven't been able to hear since 2024. Okay. Who to what? Oh, to Don. Here's to the end. What? Oh, yes, I see. To Monica. Beautiful name. And to a world without AIDS. Bill Valenti, MD. Thank you so much. Hello there. And who should I make this out to? And you'll have to speak up. I'm really having a hard time.
You can make it out to Steve.
Okay, to Steve. Did you say Steve? I just want to make sure that I get it right.
Yes, I said Steve. To Steve. You can sign it on the page where my chapter starts.
Steve. Jesus. Steve? Steve, what are you...
Don't break my cover. Sign the book first and I'll fill you in.
What are you doing here? Am I dead?
No. It's all fine. I'm just visiting. We're allowed to do this every once in a while.
We?
Sign the book.
This is definitely not normal. Okay, all right. To Steve, to the end of, well, you know what the end is. The end, not the end, but the epidemic has been over for a while. Things are so much better. Not that our work is over. We still have so much to do. So much to do.
Attaboy, Bill. Where's the champagne? Darling, let's have a toast.
But how?
It's wonderful, isn't it? One of the perks.
Heaven?
Sure. Whatever you want to call it. Heaven, paradise, Elysium, the great beyond, land of the dead, Olympus, God's kingdom, Valhalla, Asgard, Zion, Nirvana. They're all there, and it's wonderful. Just the other day, I saw David Bowie solo with the Pompeii Orchestra and the Bruce Lee Ballet Corps.
Oh, that's a big heaven.
Next week, Gloria Gaynor is performing her Shangri-La show with the Beatles. All 4 of them.
This is amazing.
This is amazing. How'd it happen? How'd you do it?
Oh, lots of failures, more success, and a network of people who care. I just wish you could see it. I wish you could see it.
I am. And it's spectacular.
Oh, Steve, all the groundwork and the research and the early intervention, it all paid off. People are on the right medications. And finally, the path to a cure is even closer. We're close. We're very close, but we're not there yet. Give it another 20 years, and maybe HIV will take a seat next to measles and mumps and rubella. We still haven't identified the vaccine, but we get closer with every trial. We just have to keep on working. Sometimes I wonder if we'll ever see that. How long do we have to keep this whole thing up?
I always knew you would keep on fighting. And that reminds me, I have a message for you. This nice young man comes to visit me every once in a while. Lived in your neighborhood, brings me all the celestial news. He was your mom's paper boy?
Neighbors were patients.
Yes, handsome specimen and juicy news.
A lot changed for me with him. Up until he passed, I didn't go to patients' funerals. I didn't have the courage. I was the AIDS doctor. What was I supposed to say? I'm sorry for your son, your daughter, your husband, your wife. They died before their time? We tried, but it didn't work. They're in a better place. I was without words. But that day, after he passed, I waited with his mother for the father. She talked about him as a child, playful, energetic, lovable, how much he enjoyed the pool, that he was the neighborhood paper boy in high school. I told her how much I enjoyed her son's high spirits, and then I told her that I grew up on the block and that I had come from lunch with my own mother. That day, I resolved to get over my own stomach. I would go to the memorial services and the wakes. I would think that it would be more human to share in a family's grief rather than beating myself up for having failed, and it might provide some closure for all of us. Attending wakes and saying something good about the patient to the people who cared for them and loved them was what I needed to do for myself. He really helped me.
What you have done is amazing.
No, what we have done is amazing. It felt like you were there with me every step of the way. Everything. We did it together. It informed everything that came after it. Early intervention, undetectable equals uninfectable. Gosh, that seems like so long ago. And we were ready for it because of all the work we did years ago, and we still have so much more to do.
We really touched something wonderful.
This is the best party that's going to happen in the future.
It has been ages since I danced like that. Not even when ABBA headlined last year's Gates of Heaven concert.
Oh, I don't know what to say.
Oh, you can see us? What? Oh, that is crazy, Bill. Wasn't prepared for this, huh?
We can break the rules every once in a while.
Usually we can't appear unless we get approval. Just like the old days.
I am stunned. We're totally stunned.
Don't worry, Bill. You won't remember it like this.
Oh, Jesus. I haven't had a hangover like this in years, and guess what? I didn't even drink. Tony was there, and John was there, and Steve was there. He was there. But that couldn't have been. They must have been my dreams. You know, we were in the past, and we were in the future, and now back here. Was any of it real? It couldn't be possible. It couldn't be. None of this is possible, and we still don't have a cure. People are still dying from AIDS, and all of the work and all of the people, it's all lost. It's just too much. It's too much, and it's too hard.
Bill, don't lose sight. All of the hard work, everything we have done, everything all of us have done will pay off. Come with me.
Oh, now where are we going?
Back to the future, but in a new time. Do you hear that?
I hear nothing.
Listen harder.
No, nothing.
Harder.
What is it?
You've never heard it in your lifetime.
It's beautiful. That sound, what is it? It's on the tip of my tongue. Oh, I know.
A silence that has never been more beautiful. A silence free of death and full of life. No more AIDS, no more HIV ever. The cure has been found. Is it screaming in your ear like it is mine?
It's totally loud and it's fabulous.
Totally. The silence is wiser. It learned from the war.
The slaughter, it was so unnecessary.
No one's life is unnecessary. Nothing is unnecessary. It all has to happen. The party had to happen, and then AIDS crashed the party, and HIV wouldn't let it end. We had to fight. The people had to fight. But now the fight is gone. The war is won, and now the silence is back.
Yes, well, you know what? Sometimes silence kills people. It kills people, like Reagan. His silence was
Let's
unacceptable.
listen to what the silence is.
Do you hear the joy? Is that what you hear too?
There's joy, dancing in the streets. I've missed this sound, and it's new to me all at the same time.
I can hear the tenderness of success and the needlessness of anger. Is that what I hear?
The pursuit of life.
Oh, I was angry. I'm not angry now.
What were you angry about?
That it took us so long.
And now?
It's gone. It's like not there. It passed. It's dead. The anger is dead. But Oh, but why did it have to take so long? I guess it doesn't really matter why it took so long. That's just anger, isn't it?
We learned how to use our anger.
Yes, but it just felt necessary before.
It was necessary. We used it to survive, to fight.
We don't have to fight now. We can think about so much more now. There's all of this space up in here. It's like a sponge. No. They take up too much room. It's like a well. Yes, like a well. And now there's the environment and civil rights and...
Hold on there. Our work is done, but the work of the gatekeepers continues. The people who keep working to keep HIV from coming back.
It's gone. It's dead. But it can always return.
It's dead, and it's asleep. But we need to keep it that way until we know different. They still need to keep the candle lit. In any wind, in any rain, if you listen, under the silence, you can hear the whispers of the past.
That's a lot of whispers to be so quiet.
They're only quiet if you don't listen. We have been given a new chance, a new way of life, and we have to protect it.
So, once we were dying to fight it, and now we live to protect it.
We do.
Hi again, folks. It's your host, Mrs. Kasha Davis. As we wrap up the Play segment of our program, we extend to you our deepest gratitude for joining us tonight. Your support helps fund our work, including outreach, testing, and engagement into PrEP, a once-a-day pill to prevent HIV. It helps provide basic needs for patients, including food, housing, and transportation to ensure security so they can focus on their healthcare needs. If you'd like to show your commitment to Trillium Health's work, consider making a gift by texting the number shown on your screen. Your contribution means a great deal to the patients and clients who depend on them for comprehensive and compassionate care. Next up, we have an exciting segment that features key friends and supporters of Trillium Health. Please enjoy the history of Trillium Health through their eyes.
Pamela, how did you first meet Dr. Valenti?
I met Dr. Valenti in 1986, shortly after I was diagnosed with HIV.
Interesting for the time frame, because the late 80s is still the time frame that this, the AIDS crisis was really developing.
Yes.
Right, but there was a lot of misinformation. If somebody told you right off the bat that you didn't need to be tested.
Right.
Wow.
Absolutely. And what were your thoughts, having first seen the epidemic unfold? I'm sure you were aware of the news and what was going on.
I was in it. I didn't have a lot of thoughts.
Yeah.
I was then a raging drug addict, and it was gay men.
Yeah.
Later on, it was also people that were IV users.
Mm-hmm. Absolutely.
So I met a guy that I loved, that didn't use, that knew I did. I was in recovery for about a year, and he said, "You need to get tested." Horrible. Well, nobody knew what the hell they were doing. It was thank God I met this man, or I would not be here. I'm convinced of that. Yeah.
I think you speak for a lot of people in that realm as well. Dr. V, you had a major hand in the process of treatment, the process of everything that was happening in the region in Rochester regarding HIV, and I'm assuming there was a lot of rule breaking involved in that process. What was that like?
Well, if you come from a culture where you're not allowed to break the rules, you know when it comes time to break them. So I recognized right away that this wasn't the same old in terms of following the rules and playing it by the book, because there was no book. The decision making every day was, well, a new decision to be made every day.
That was the book.
Right. We wrote the book as we went along, or, built the car as you go down the road, that sort of thing. It was that kind of thing. But we broke a lot of rules to get treatment into people as quickly as possible.
Wow, things are so different now, and people are living. It's not a death sentence,
People are thriving.
Yes,
even.
It's not just living. People are just doing whatever they wanted. Back then, people weren't buying homes. They weren't getting married. They weren't, they were selling their life insurance policies.
Right.
That's what it was like then.
Right.
Planning for death.
And you were there for so many people, leading them on the path to recovery, to health, to getting better, to finding treatments, which is why Pamela is here today with us, which is why I'm living with HIV. I take 1 pill a day, and that's a contribution from you and from so many other people in this process to, combat this epidemic and end it.
Okay.
Well, it was our colleague, the late Steve Scheibel, who really understood the value and the role of combination therapy for this. So you're not going to be able to treat it with one drug.
Okay, so I just retired 3 years ago, and
congratulations.
I've been thinking I'm not really supposed to be alive, because it wasn't just HIV, there was other things too. I ran myself over with a truck, I had Hep C, which I don't have anymore. There's been a lot of things that should have killed me. And so I keep thinking there's a reason I'm here. And then I have some guilt. I don't know if I've ever told you this. Like I said, I really never thought I would live this long. And I probably got some more time to go. And like I said, I know I'm convinced I would not be here. People would come up to me and say, you want to do a film to leave for your children when you die? And, different things like that. This man never said if or when, ever said if you get sick or when you get sick. Never, ever said those words to me.
There's something to be said as someone else living with HIV in a very different time frame, with different medications, with different levels of treatment. That level of stigma is always looming in the back of my mind too as well, where there's always a what if concept in my head about having this disease that has impacted generations, communities, continents around the world. That assuredness from a doctor, that level of confidence, that level of, that's love, is what it is. That's care and love, and it's assuredness that was needed then and is needed now.
Well, we tried to get away from the stopwatch idea of how much time do I have. Carol Williams would respond to patients who said, they would say to her, am I going to die? And her answer was, not today. Where the perception was, we're all dead here, one way or the other. The idea was to try and turn that around and give people something to live for.
Well, actually, we were involved before Community Health Network. So when the AIDS clinic at Strong was the only thing available, and when it became obvious that folks were having the same problems here that we had heard about and read about in big cities like Los Angeles and San Francisco and New York, the clinic became extraordinarily important to many of our friends. And it was Bill who said, you know, the clinic needs some funds to do more outreach, and we need to get our friends involved and do something to raise some money to support this clinic. And that's what we started to do.
I'd like to mention Sue Cull also, because she
Yes.
played a very important role. And I remember Sue called me up one time. She goes, "Let's write a safe sex brochure." So
Yeah.
we did. But,
Yeah.
and she was early on at AIDS Rochester, and she went on to do the HIV STD clinic in Monroe County. And she was president of AIDS Rochester for a while.
One of the founders of AIDS Rochester. The first meeting took place on her porch.
Yeah.
Well, I think some of us became good fundraisers in part.
Yes, but we also sort of became our own little help network. We were on trees to take dinner to friends who weren't able to cook for themselves. We were on errands to pick up things, and we were accompanying folks on appointments. And quite honestly, when you made the appointment, there was every expectation that somebody was going to be able to walk in on their own, and by the time you picked them up to go, you really had to carry them because they really needed help fast. So it was raising money, and it was also doing what needed to be done. Think back to the first Dining for Dollars, the first fundraiser that we did. That was really all of our gay friends inviting all of their gay friends to dinners at their home because we didn't want to spend we didn't have any money to spend. And then we had a party afterwards with entertainment, and we thought it was going to be a pretty quiet, refined kind of an affair where people would come and have after dinner drinks, and it turned out to be a rave kind of an event. I mean, the walls were just seething, but that was all us taking care of ourselves. And I think what the biggest surprise for me, that in the next 2 years of Dining for Dollars, it wasn't just us. People wanted to come and help. We had a lot more sympathizers, and we had a lot more friends than we thought we did. And that, I think, has continued to be one of the great contributions of all that's trouble, in that not only is the gay community taking care of its own, but the community at large wants to be a part of this and help.
And it became a movement, which I think is different than what we're experiencing with the COVID pandemic. That the way people come together around that it just feels different than the charged atmosphere of the early days of HIV, where people really did mobilize.
So speaking of movements and mobilization, I know that's not always sunshine and rainbows. I want to hear about the rule breaking. I want to hear about what did you all do to break barriers and to get people the access that they needed to services that they needed.
In an effort to get more funding for drugs, a group of advocates, which was the forerunner of ACT UP, an early advocacy movement coalition. But in any event, the short story is that I ended up lying in the middle of the intersection of Monroe and Goodman with a group of patients. And the patient who was lying in the street next to me, when we heard sirens coming, he said to me, "You know, Doc, you're no good to me here on the ground. You need to go back to your stethoscope or go back to the office." So I made my statement by lying in the street and then getting out of there. But it also helped define me in terms of what my role was with this, and I thought after this I should stick to what I know, which is being a doctor rather than lying in the middle of the road.
Well, I'd like to say that Bill really was the lights, camera, and action guy for HIV. He worked with a very serious group of scientists at URMC, but he was the one that took the lead for the community.
I think we have a lot to be proud of. I think for a little town, we took the advantages of a little town in that we knew people and we knew each other, and we came together rather easily.
Yeah, we knew each other. It was a very powerful network movement.
That must have been very difficult at the time, with the community being small, the benefit of everyone knowing each other, being able to lean on each other, but then also being hyper aware of who's passing, how often people are passing. How did you all deal with that? What was your sort of, we call it self-care now. How did you get through all that?
I don't think that was easy, and I think there was constant, gay chatter, I'll call it, or rumor, and sometimes nasty comments about people. In addition to people having HIV, a lot of people were blaspheming for having it, or maybe possibly giving it to someone else.
So the stigma in those emerged in those days. I mean, we had this strong network of people doing things, but there was also the HIV stigma piece.
The funerals came pretty fast, and we weren't ready for that. I mean, we were all absolutely in our prime and even younger, and these beautiful men were just dropping, and then you had families that wouldn't accept their illness, and then would not accept their friends for the ritual of mourning.
So we want to help the next generation continue the work.
And isn't it wonderful that, it's evolved to be about LGBTQ plus health and not about illness. The conversation is evolving, and that's exactly what you hope would happen, because it's not just going to be one thing, and what we've learned in the last year and a half is there are things we don't even want to think about that not only affect us and our community, but affect everybody, and we're part of that.
Around 1986, 1987, through HPA and through the vaccine trials.
And for those who don't know, what's HPA?
Helping people with AIDS. It was an organization that began in 1986, and its specific focus was to provide financial support to victims of AIDS and AIDS patients, because in 1986 there was no money coming through any federal pipeline. The AIDS Institute was in existence, and the AIDS Institute did provide some funds for organizations, but there was no one to take care of food, housing, prescription drug, even though they weren't prescriptions, they were drugs that people had to take for other things.
And I met Bill when I was a resident in psychiatry, and the chairman of the department at that time, Eric Kane, said, there's all this interesting stuff happening with this new disease, and they could really use some help over there. And then, not many days after that, you could tell the story. And you were thinking, what do I need her for?
Right. Why do you need a psychiatrist for HIV, for AIDS? We didn't even know it was HIV then. But a patient who treated himself to a $200 or $300 lunch at what was the top of Midtown, the restaurant at the top of the plaza. Then couldn't pay the bill. He didn't have any money. And the people there thought there was something wrong about that whole thing. They found my business card in his wallet and called and said they had, it looks like we have one of your patients here. And we sent him to ED and to the emergency department at Strong and went down to see him. And I very diplomatically asked Dan, well, you take over now. You figure out what's going on here and I'll come back later. And when I came back, she had diagnosed the first case of AIDS dementia that we had ever seen.
As Dan Myers said, the onslaught of illness and sickness that came was totally unexpected, just overwhelming. And there were a lot of people who stepped up to the plate. I mean, you had not only advocates, but you had AIDS Rochester in existence by then. And then the drag queens stepped up to the plate, and the bars stepped up to the plate. It became a community effort to defeat this thing and to find a cure.
Coronavirus, where everybody in the world has more information than they could ever possibly process about this. There wasn't much information. I mean, you know, those of us in the medical field were getting case reports and individual studies, and there were whispers about, you know, GRID, different kinds of gay-related disease, etc. And it was, again, unusual in the beginning because what happened is typically young, healthy men presented with opportunistic infections, things that you would not expect a young, healthy man to have. And then there was the next phase, which is as we identified the HIV community that was part of the addiction community, and with the passage through needles, and certainly the hemophiliac community with transfusion, and then the partners, not just male partners, but the challenge of wives finding out that their husbands were sleeping with men.
Well, it is a sexually transmitted infection, which made it all the more, I don't know, was it difficult or more stigmatized in terms of getting to the point with people, because we then had to deal with really the most intimate part of people's lives.
It's one thing to have to respond to physical need, or a need for food, or a need for housing, or a need for clothing, rent. It's another thing to respond to the emotional and psychological needs that ravaged this community for years and years.
Prior to that, you know, it was a scary thing. People were dying, but people could also marginalize it and say, well, as long as I'm not having sex, you know, like that, I'm not having sex with a gay man or something, I'm okay. If I'm not sharing a needle, I'm okay. And, you know, people had horrible things happen. People spray paint fag on your house. I mean, those kind of things happened, not rarely.
Well, to kind of bring it back to the beginning and about, you know, this whole program, maybe I can start with you, Dr. Vellani. The illustration on the cover of your book, what does that mean to you?
Michael Chiazza's silkscreen print called Dance. And if you look at that print there's a piece of pie, there's a person dancing, there are positive things in each of those images airplanes, travel, doing things that people wouldn't ordinarily, that would want to do but wouldn't be able to. So it was designed to put a positive spin on this and to give people hope, to be hopeful. So he designed that by himself, and we printed 100 of those posters and still have a few around that we save for special occasions. But I think it really reflects the era in terms of some joy that we wanted to bring into people's lives. Hi everyone, this is Dr. Bill Valenti here, and I am here with Chuck Marbley on Zoom. For those of you who don't know him, Chuck is a longtime friend and the husband of Dr. Steve Scheibel, 24 years in fact. So Chuck, welcome.
Thank you.
I think about Steve Scheibel a lot these days. During the pandemic, this would be our second pandemic, and I thought that HIV would be it. You get one pandemic in a lifetime, but now there's two. And one of the things I want to do when I think about him is I think it'd be nice to talk to him and ask him, well, what would you do in this situation? How would you handle it?
He was one of those few people that could get to every single person, even the most difficult patients. He had the ability to dial in on their wavelength so they would understand and break that medicine and that science down to a point where they would get it, and then they in turn would be sharing that with everyone else, all of their family and their friends. And it is very sad. As I shared with you earlier, I still dream about him when I need him, and he talks to me and he tells me things, but then I wake up and he's not there. Imagine having the patience of a Mother Teresa, or having that heart where every single person you interact with is the most important person on the planet. And can you tap into that and be that for that person in that moment, so that when that person leaves, you've changed their lives. You have created a ripple effect that who you are, that interaction has now set them off in a totally different trajectory. And to have that capacity of love and selflessness, very few human beings on this planet have ever had. I was fortunate enough to experience that firsthand and to see it, and then to hear those people sharing that love, that, he encouraged me to go back to school. He encouraged me to stop doing meth and to change my life. He encouraged me to get out of that broken relationship and love myself and have that same respect. So to have that guidance, to put someone's heart in your hand, but then to let them go so that they could then grow on their own.
Good evening, friends and supporters. And for the last time, welcome back to Trillium Health's virtual fundraiser, Unfinished Business. We hope you had a great time with us, and we want to extend our heartfelt thanks to everyone here with us tonight. And I hope you liked my costume changes. Woo-hoo-hoo-hoo. If you haven't yet, please consider making a donation to Trillium Health by texting the number on your screen. We believe that everyone who walks through our doors deserves high quality and affordable health care, regardless of income, sexual orientation, gender identity, race, or ethnicity. And that is why every gift tonight makes a difference in the lives of our community members who need it most. To close out our show, I am honored to introduce to you Mrs. Andrea DeMeo, President and CEO of Trillium Health. Andrea has dedicated her life to public service and embodies Trillium's values of equity, justice, and public health. Welcome, Andrea.
Wow, what a wonderful, moving, and important remembrance of where we began and where we are today in our work to end the HIV epidemic. Thank you all for tuning in with us tonight. I hope you've enjoyed this very special program that honors the life-saving work of our co-founders, Dr. Bill Valenti and Dr. Steve Schleibel, which began at the onset of the HIV/AIDS pandemic 40 years ago, at a time when very few would, or even could, care for those impacted by what was, at that time, the most feared disease in modern medicine. What we shared with you tonight represents Trillium Health's legacy, one that is built upon courage, hope, and innovation. It is this legacy that has forged us into who we are today, providing the highest quality of comprehensive, equitable, non-judgmental health for all in our Rochester community, regardless of someone's ability to pay. Thanks to the help of friends like you, we are able to carry out our mission of extraordinary care for all, always, and our vision of being the premier community health center in New York State that enriches and saves lives. On behalf of our patients, team members, volunteers, and board of directors, we extend our sincere gratitude for your incredible generosity of our sponsors, donors, friends, and family. Thank you for your support that allows us to continue our essential work for our community.
Thank you, Andrea. And our deepest gratitude goes out to tonight's loyal sponsors and everyone watching. We hope you've enjoyed the program and will return for our other upcoming events this year. The show could not go on without your continued support. It's always been that way. It's always been important to me that people know what the beginning of the HIV epidemic looked like. There was a lot of fear, anxiety, and heavy emotions, similar to what we experience today with COVID-19. When I think back to those times, I remember the energy of how passionate and determined we all were. That energy stemmed from the need to respond to the public health crisis and help people quickly and efficiently as we could. That energy is carried to the present as we face the COVID-19 pandemic head on. We've provided testing, vaccines, and resources for our community. For work like this to continue, we turn to you, our supporters. As you reflect on tonight's program, please consider making a gift to Trillium Health. We've always provided stigma-free, barrier-free, and compassionate care to all, and that'll never change. But with your support, we can connect and retain more people in care while eliminating financial barriers. Every dollar can change the lives of our patients. So thank you again for your generosity and for tuning in with us. We hope you've enjoyed the show. Good night.